If your shoulders are tight, stiff, you can't throw things or give awesome high fives, and you want mobility improvements like these guys right here, then try the exercises that I'm about to show you. All of these movements work on improving ribcage mobility. The ribcage is the foundation of the shoulder and shoulder blade, which allows you to externally rotate. With this first move, we're going to compress the sides of the rib cage. This opens up the front to back dimensions, which improves the shoulder blade's ability to slide and glide, allowing you to get into that externally rotated position. Grab a yoga block, place it on the middle third of the rib cage. If it's too uncomfortable, you can put a pad or a pillow over the block. Roll forward slightly so your weight is on the bottom outside knee. Take the top arm, place it in an abducted position with a bent elbow. This is going to help open up the top side of the chest, which is needed to get the arm back into that externally rotated position. Eyes looking straight ahead, take a silent breath in through the nose. On the exhale, think about melting down into the block. Be as relaxed as possible. Hold this position for 5 sets of 5 breaths on each side 2 times per day. For the shoulder to externally rotate, the shoulder blade needs to be able to internally rotate, which looks like this. In order for that to happen, certain portions of the rib cage must expand. Typically, that is the back upper part of the ribs and the front lower part of the ribs. When both of these areas have too much muscle tension, they push the rib cage down like this. And you can see when I get into that position, I lose external rotation. Now, some people need to emphasize more the bottom front, and others need to emphasize the upper back. To see which you need to focus on, raise your arms overhead. If you notice that you arch your back significantly, you need to emphasize the upper back area. For that, we're going to use arms across the chest, or as I affectionately call, the corpse pose. RIP to your mobility deficits. If, as you raise your arms up overhead, you don't notice that arch, or your head juts forward, or you slouch even more so, then you're someone who needs to emphasize improving mobility in the bottom front part of the rib cage. For this, I would recommend using the scared arms position. So imagine you're in a scary movie and you're putting your arms up like, no, don't attack me. That's the position that we want. So pick your arm position and go through the rest of this progression using that strategy. Lie on your side, have your bottom leg in about 60 degrees of hip flexion. The top foot is in front of the bottom ankle. Roll forward so that way you feel the bottom outside knee. If you can't sense that, try putting a wedge underneath your hips. That way it tips you into that position. Place your arms into either the scared position or the corpse position. Hold that and breathe silently in through the nose, soft and slow through the mouth for 5 sets of 5 breaths, 2 times per day. Now, if you're in pretty solid shape and you think that's too easy, then you can do the same positioning with a side hang, either off a bench or in a glute ham raise. This will absolutely demoralize the abs. Just make sure as you're in position, your torso is parallel to the ground as well as your head. A lot of times people will either side bend their trunk up or their neck up. You want everything in a parallel position. Choose your desired arm angle and do the same 5 sets of 5 breaths. All of the other positions were non-weight bearing because that minimizes muscle tension. Now we're going to incorporate it and drive the humerus into an externally rotated position. Stay on your side, mimic the same leg position that you've done for all the other moves. Only this time, you're going to have your bottom arm at about 60 degrees of shoulder flexion with the elbow bent. Roll over the top again. This time you should feel weight on the bottom outside knee and the bottom outside elbow. If you do not, use wedges to tip you into position. With your top arm, choose either the scared position or the corpse position. Silent breath in through the nose. On the exhale, push your torso up by keeping weight on the outer elbow and the outer knee. Maintain a 3 to 4 pressure and hold your trunk in this position for 5 sets of 5 breaths. This last move incorporates leg lowering, which makes it by far the most challenging. But if you can do this and you don't crunch, your shoulder mobility is going to be next level. Lie on your back with your hips bent to a 90-degree angle. Straighten the knees until you feel your weight on the PSIS, which are the 2 bony points that are at the top of the pelvis. Have your arms be in the position you need. Make sure your upper back and lower back are in contact with the ground. Just make sure that you are not crunching or tucking your hips to get it there. As you breathe in through your nose, lower one leg to the ground without arching your back or crunching. Exhale, back to the start. Alternate sides, maintaining arm position throughout. Go 2 to 3 sets of 6 to 12 reps per side. If that starts to get easy, you can alternate moving the legs back and forth. Now, if you notice that you're also limited in shoulder internal rotation, then I would check out this video right here because it goes into my top progression for improving this shoulder motion.